If you've ever worried about your heart health or a loved one's, there's a test that offers answers without a hospital stay or surgery. It's called a coronary CT angiogram, and today we're learning about how it works and why more doctors are using it to catch heart disease early. And joining me are Dr. Kimberly Brokenbrough, CEO and radiologist at CardioVision, and primary care physician Dr. Tom Duncan. Thank you to you both for being here.
Thank you, Kelly.
Thanks for having us.
Amazing. So, Dr. Brokenbrough, I want to start with you. Let's start with the basics. What causes a heart attack?
Most heart attacks are caused by a rupture of a plaque in the artery. So your heart is your pump, and your blood vessels are your pipes, and junk in the pipes is atherosclerosis. And so when that builds up, it will cause plaque build up, and then if it ruptures, it's a heart attack. And you can have big ruptures that somebody drops to the ground, and then you can have smaller ruptures where it may cause congestive heart failure, but you don't necessarily know it as it's happening. That's what happens in the heart. And in the brain, a big rupture is a stroke, and a smaller rupture can lead to dementia.
Wow. And so what exactly is a coronary CT angiogram?
So a coronary CT angiogram is a CT scan. And we have a picture here showing the first picture is a calcium score. And there's different types of plaque, of this junk in the arteries. There's soft plaque and there's calcified plaque. So the calcium score shows the calcified plaque, which is more stable and it's less likely to rupture. The coronary CTA, if we can pull that picture up again, shows both the soft plaque and the calcified plaque. And that soft plaque is what is scary and dangerous and can rupture, and it can be eliminated with medications.
Okay, and Dr. Duncan, I want to get to you. Why do you refer patients for this test?
This is personal to me, Kelly. My sister died at 55 from a heart attack, and so this is a passion. I'm just so grateful to be here to share this, because this saves people's lives. People, especially guys, we go through our life and we go to work, we take care of people. We don't even think about our health until the wheels fall off. This is a mammogram for the heart. You can see inside the blood vessel. You can see it when it's just at the beginning. Then it becomes real, because until then, oh, there's just cholesterol numbers, it's just blood pressure, not a big deal. But when you see that plaque, it becomes real. And then that's when people really want to start taking action, because we know it's the #1 cause of death. Why not identify it early, reverse it, and live a longer and healthier life?
Absolutely. And so who's a good candidate for this?
So a good candidate, are you breathing? But
Everyone.
But everyone. So, but on a serious note, when you start looking at risk factors, you take a look at family history, early heart disease, how many trips around the sun if you're 55 or older, risk factors, high blood pressure, smoking, elevated cholesterol particle numbers, apoprotein B, insulin resistance, and then also lifestyle. Do you smoke? Alcohol? I see a lot of CEOs and endurance athletes that have a heavy burden of heart disease that you would look at them and go, that doesn't make any sense whatsoever. So also people are like going, I just want to be proactive. And then they can start really looking at, it gives them a goal as they're working out or they're making healthy choices. It really gives them that feedback. It gives them a sense of purpose that they are really making a difference in their health, because it's, again, you don't feel it. We're simple creatures. We move away from pain and towards pleasure. And so if you don't feel it, you don't know. And so it's really good to have that information.
It really is. And let's say the scan shows a blockage or buildup. What happens next?
Well, if it's significant, Dr. Brokenbrough will give me a call and let me know ahead of time. But then I sit down with the individual and we say, okay, what is a personalized plan that does this? And what it is, the basis is sleep, nutrition, exercise, stress reduction. Sometimes it's about eliminating things, not adding more things. But then again, you look at supplements, then I'm looking at the role of medications. What I've been gifted is to be able to see the results of people on the medications that actually reverse the plaque, stabilize the plaque. I've seen people go with significant blockages, 70, 80% on double therapy of a statin and Repatha, which is a PCSK9. actually shrink it to almost nothing. It's amazing. And when initially I wasn't too sure about medications first, because I'm more of an integrative medicine, but wow, to see it on the scans, to see the reports and see how people are feeling, it's magical.
I know, and I want to end with that. What do patients usually say after they've had this?
Well, what they say is like, okay, now it's one of the things, what a great sense of relief it is, or the other one is like, okay, now I know what I need to do. And so in order for me to continue to, a lot of them are like wanting to live for their families, their grandkids. It gives them it gives them really tangible way to dig in and go, okay, I can reverse this, I can take charge of my life and continue to live in a very healthy manner.
And I understand this is non-invasive, correct?
It is correct. I love it. It's a CT scan, it's an IV, you get a little contrast, you get a little spin, and you walk out. Dr. Breckenbrough gives you those results right then, right now, and then you know when you walk out instead of waiting 7 to 10 days to get the results.
Awesome. Thank you both for being here.
Thanks
Exciting
for having
stuff.
us.
Thank you.
And to learn more about what we discussed today, please visit the website that you see right there on your screen. Right now, CardioVision has a special offer for New Day viewers. Get $50 off a preventative heart health package with the code NEWDAYSEPT, S-E-P-T. That's all one word.
New Day Northwest is sponsored by CardioVision.